You're listening to Brunch with me, Noreen Mayer, on this Wednesday morning. Let's turn to our next topic and guest of today. In the next 15 minutes or so, we're talking about prenatal testings and some of these testings or prenatal screening tests can assess your chance of having a baby with various congenital conditions. And to talk about this, I'm really delighted to be chatting once again with Dr. Carina Chan, who's a specialist in reproductive medicine. Welcome back on the program, Dr. Chan. Thank you so much for joining us this morning.
Thank you, Noreen. Hello, everyone.
It's so nice to meet you in person. We spoke, I think, last year about reproductive topics also. We are live this morning on Facebook, so I'd love for our listeners to join us there. Noreen Mayer on RTHK Radio 3. So perhaps, Dr. Chan, let's talk a little bit more about what exactly are these prenatal screening tests?
Prenatal meaning before the birth of a baby. So when we talk about prenatal screening tests, we usually referring to a woman who is already pregnant and she wishes to know whether the baby is healthy or not. So basically, we're talking about two big group of tests. The first one is to screen for fetal Down syndrome to check whether the baby is affected by this condition. And the second is the structural scan or the morphology scan. Let's talk about these two groups one by one. The first group is the Down syndrome screening. Now, Down syndrome is a chromosome problem. We all have 23 pairs of a chromosome that comes in pairs. So each of us should have a total of 46 chromosomes. But for Down syndrome persons, they have an extra copy of chromosome 21. So they have a total of 47 chromosomes. And this extra chromosome will affect the function of the body in many ways, as we know. Right, so the chance of a woman carrying a Down syndrome baby is not related to her family history, is not related to herself or her partner. It's entirely related to her age. And the risk of this woman carrying a Down syndrome baby increases with her age.
So even with a family history of someone with Down syndrome, this is not really an added factor. It's to do solely on the woman's age.
Mostly. So for someone who have had the Down syndrome baby in the past, the chance of her having a next pregnancy affected by Down syndrome is just minimally increased.
I see.
On the other side, for a woman who has had a few healthy babies already, and she's now at the age of 40, the risk of her carrying a Down syndrome baby is just the same as any other woman who are also at this age.
Okay. And so how does the risk increase according to the age?
Right. So to give everybody a perspective, we're talking about 35 years old as the cutoff for the conventional cutoff for advanced maternal age.
Geriatric mother.
No, we shouldn't say that. We're more mature.
Exactly. I thank you for saying that because I definitely felt like an older mum compared just based on my age. But these days, a lot of days, more people are having children at a later age.
Yes, we call it mature.
Oh, good. Yes.
Yeah, and this is not absolute. There's no magic about this absolute cutoff. It's just for scientific purposes. When we do studies, we still have an age cutoff, or when we are talking about whether we advise women to undergo invasive testing, we still have to have a cutoff. That's about it. All right. But just to give everyone an idea, when we're talking about age-related Down syndrome risk, for example, a woman at the age of 30, the chance of her carrying a Down syndrome baby will be 1 in 900. When she gets to the age of 35, the risk will be 1 in 350.
Wow.
And that further increases to 1 in 100 when he gets to the age of 40.
Wow. So when a woman is 40, her chance of having a Down syndrome child is 1 in
100.
Wow. 100.
Right, but if you look at it from the other angle, the chance of her having a healthy baby will be 99 out of 100, isn't it?
Yes.
So it depends on how you look at it.
Absolutely. That's a great way to see whether or not the cup is half full or half empty.
Yes.
And also, the value of life isn't, based on somebody's condition.
No.
I should really stress that, children or people of all types of ability, whether you have a disability, their life is just as worthy as anybody else's.
Yes.
Yeah, absolutely. So, Dr. Chan, in terms of, so that's one of the reasons why people get tested. How are they being tested? Because in the public system, we talked about this before we started the interview. They measure the neck fold. Could you explain
Yes.
a little bit more?
Yes. In the past, as I just said, we use 35 years as the cutoff to advise women whether they should go for invasive testing. Have you heard about amniocentesis?
Yeah.
Right. So that is a very accurate test, but it carries a very small risk of miscarriage. So that's why in the past, we only advised women to go through this process if they have a higher risk of carrying a baby that will be affected.
How does that work? What's the procedure of that?
It is done somewhere at around 16 weeks of pregnancy, and we pass the needle into the pregnancy sac to aspirate a little bit of the amniotic fluid out and send it for testing. So as you can imagine, the needle goes into the uterus, and it carries a very small risk of miscarriage as a result.
Okay. And then that can be tested. And how accurate is that testing?
It's almost 100%.
Oh, wow.
Almost.
Almost.
Nothing is absolute.
Yes.
Yeah, but because of invasiveness, we only offer this option to women who are at higher risk in the past. But then there came the non-invasive options. So there are two non-invasive options now. One is the nucleotranslucency measurement, or the NT. Some people call it NT in short. But in fact, the full name is an Oscar test.
Okay, Oscar test. Oh, okay.
Yeah, but it involves actually a few things: the mother's age, and then a measurement of the baby's neck fold, the NT measurement. Also, we need to take a blood sample from the mother to check for two hormones called BAPPA and HCG. I don't bother the audience with the names
human
of the
growth
hormones.
hormone.
No, the placental hormone. Yeah.
Okay, I see.
But anyway, so we put all these figures into a formula, and then we do a calculation on the risk, and it comes up with a risk score. If this risk score says that the woman is at low risk, then we think that the baby should be okay. If it says the woman is at high risk of carrying a Down syndrome baby, then we will have to undergo further testing, including one of the options will be perform amniocentesis.
I see.
So that's a non-invasive test. You can imagine it involves a blood test of the mother and also an ultrasound scan. So it's not, it does not have a risk of miscarriage.
Okay.
So that's why it can be offered to all women. And that's a first option of having a non-invasive testing for Down syndrome. The second one is we call the NIPT as a non-invasive prenatal testing. This one is is a newer option. It involves also a blood sample from the mother. And this time we are looking for placental cells from the mother's blood and use these DNAs to test and see whether the baby is affected by Down syndrome or not. So this test is newer and is more accurate than the Oscar, and it actually tests more conditions as compared to Oscar.
And you can do it quite earlier on in the pregnancy also.
Yes.
And I think that's commonly, I think people know that as T21,
T21,
or one of them.
Yes, it's just one of them. NIPT is the name of the group of tests.
I see.
And under this umbrella, there are a few brands, in fact, a few laboratories that are offering similar tests. So T21 is just one of them.
Okay. And what other genetic testing is included in that then?
Now, for Oscar tests, it tests for fetal Down syndrome, as we talked about. It also tests for trisomy 18. That means that the baby has got an extra 18 chromosome, and also trisomy 13. That's for Oscar, the three chromosomes, the 18, 13, and 21. The reason for testing these three chromosomes is because when baby can be that's advanced in the gestation up to 12 weeks pregnancy. If the baby has other chromosome problems, they cannot survive that long.
Sure.
And these three chromosomes are the commoner problems that we can encounter at this gestation, especially Down syndrome.
So T21,
Oscar.
Oscar, 321 chromosomes, that's Down syndrome. And what about
Including
18?
Down syndrome.
Okay, what about 18 and 13?
18 is called Edwards syndrome.
I see.
And babies are very abnormal if it's affected by this condition, as well as chromosome 13. And for these two conditions, the babies can survive during pregnancy. Some of them cannot. Some of them, we may lose them during pregnancy. And most of the time when they can reach term, and they can only survive for a few days outside the mother's body. So these are quite fatal and deadly conditions.
And it sounds like the procedure is relatively straightforward.
Yes.
It really is just the blood test from the mother.
And the scan.
And the scan, okay. Yeah. And is it time sensitive as well?
Yes. It can only be done between 11 to 14 weeks of pregnancy.
I see. Okay, so it is very time sensitive.
Yes.
And then when it's done outside of the margin, does it affect the results?
There will be no reference for the blood sample. So we cannot come up with a score assessment.
I see. And so who should consider these sort of diagnostic testing then?
These are screening tests, not diagnostic.
Okay.
So all pregnant women can actually consider because it's risk-free.
Okay.
Yeah.
So, do some women choose not to do any testing?
Yes,
okay.
yes. I have. I remember a patient of mine who, after discussion, she said that I understand the discussion and I decide not to undergo testing, and then ask her why, and she said that because I'm a Christian, even if the baby is affected by one of these conditions, I'm going to keep the pregnancy.
Sure. Yeah, and that's very much respected.
Yes.
Although my perspective is, if you decide to keep the baby anyway, why not know it? Because then there's early intervention. I think some of the times when you often read or you often see maybe the child is born with a condition with their heart and they really require a very time sensitive operation straight after birth. So wouldn't it be better to,
Absolutely agree. So there are two schools of thoughts. We can't say who is right and who is wrong. So for my patient, it's absolutely not right for her to make such a decision. And for other mothers who may, as you said, may decide to keep the pregnancy even the baby is affected, then they will say that, right, why don't you give me a chance to know and to learn and get me prepared psychologically, socially, and in terms of maybe some family may have to
make some certain arrangements.
Or help when the baby is born. And so that will give everyone the easiest way to go through the whole pregnancy and baby care. So that's another way of looking at things. It doesn't mean that if a baby is affected by any condition, we will have to terminate the pregnancy. This is absolutely not the right way to do.
Absolutely, yeah. And I mean, I'm sure, Dr. Chan, you've seen so many patients. I mean, what happens if some of the screening comes back with some of the results which they were not expecting? If some of the results come back positive, what are sort of the options in Hong Kong? And what have you seen?
We of course we have to explain, and all these screening tests, that the answer is not absolute. Screening tests means that they can be right and can be wrong. So we need a confirmation. That is a diagnostic test or confirmatory test. And most of the time we'll be talking about an amniocentesis this time. So nowadays I can say amniocentesis is reserved for women who are really at high risk of carrying an affected baby.
Yeah, okay. And that's the one you mentioned just now when they insert the instrument to aspirate the fluid.
Yes.
And even though it's not 100%, those are quite accurate.
Yes.
Yes, okay. We are coming up to the news and there's still so much to talk about. Dr. Chan, maybe if we can ask you to stay a little bit longer until after the news, because I'd really like to discuss one of the more popular tests here in Hong Kong, which includes the Fragile X syndrome carrier screening, which is quite a popular test here in Hong Kong. Perhaps we can talk about this after the news. RTHK Radio 3. You're listening to Brunch with me, Noreen Mayer, on this Wednesday morning. We're continuing our chat on prenatal genetic testing this morning with Dr. Carina Chan. And I'd love for our listeners to join us on Facebook also. Noreen Mayer on RTHK Radio 3. You'll be able to see and hear Dr. Chan there. So earlier, before the news break, Dr. Chan, we were talking about these testings, and we want to touch on some of the more popular ones here in Hong Kong. And one of of them includes the Fragile X syndrome carrier screening, which, to be honest, I'd never heard of until recent years. So could you explain a little bit more of this?
Yes. Then in order to understand this, we have to have a little bit of knowledge about genes and chromosomes. Now, I mentioned we as human, we all have 23 pairs of chromosomes. The 23rd is the sex chromosome. For women, we have both X. For men, they have one X and one Y. So everyone have a total of 46 chromosomes. And in each of these chromosomes, there are many, many genes. And for humans, it's estimated that we have somewhere between 20 to 25,000 genes residing in all these 23 chromosomes. So one chromosome may be carrying a few hundred to a few thousand genes. And these genes actually determine our function and our characteristics, like our hair color, our eye color, our skin color. And some of these genes determine our internal function, our heart, our kidneys, and everything. Right, so we have two sets of chromosomes. One set's coming from the mother and one set's coming from the father. So for each genes, we have two copies. And then these genes, if they're normal, then we have normal function. But what if these genes are defective? So if there are two types of diseases, these genetic diseases, one type is what we call dominance diseases. The other type is recessive. And we attach another word in front of it we call autosome. Autosome refers to the 22 chromosomes, the first 22 chromosomes, not the sex chromosomes. So we call these autosomal dominant diseases or autosomal recessive diseases. And that means for autosomal dominant diseases, if one of the genes is defective, the person will have the disease, will have the symptoms, then we can tell.
It overrides the...
Yes.
Okay.
One defective gene can already bring about the disease. But for autosomal recessive diseases, you need two defective genes in order for the person to manifest the symptoms. So for recessive genes, a little bit tricky. It will not be easy for us to find because those persons who are carrying just one defective gene with another normal gene functioning, then this person is a perfectly healthy person. He or she will not know that he or she is carrying this defective gene if we do not subject this person for testing. Yeah, so then we will be talking about genetic screening. Genetic screening is by means of a blood test to see this particular gene, whether for this particular person, whether these two genes are normal or defective.
Yes.
Yeah, so this is called genetic screening. And Fragile X is one of them.
Okay, and what is that test for then?
Fragile X is a problem lies with the X chromosome. It's a X chromosome dominant disease, meaning that if one of the X chromosome is defective, the person will have the disease. And this disease is even more complicated. When it comes to then we may have to talk about the gene constitution itself. The gene consists of DNAs. We know DNAs, and that's the basic building block of a gene. So a gene actually contains many, many DNAs inside. And if the gene is defective, it may be some of these DNAs are not normal. And for this Fragile X syndrome, the gene is called the FMR1 gene.
Oh.
Yeah, in this gene, there is a line of DNA that repeats itself. Is called CGG repeats. So it depends on how many of these repeats there are. If there are many, many repeats, then this person will have Fragile X syndrome. And Fragile X syndrome is a very severe problem. It affects male more than the female. As we can imagine, for male, there is only one X chromosome. So if this X chromosome is affected, then the person will have all the symptoms of Fragile X syndrome.
I see.
But for a woman, for a girl, she will have two X chromosomes. If one of these X chromosomes is defective, at least she will have a little bit of the
a
functioning
buffer of the
X.
other X.
Yes. So Fragile X syndrome actually affects male more than female. And even if it affects a female, the symptom is usually milder. Right, so we talk about this CGG repeats. If a person has a low number of CGG repeats, then this person is called a healthy person, and this person is carrying a normal Fragile X gene, the FMR1 gene. But if this person is carrying an intermediate number of CGG repeats, we call this a pre-mutation carrier. Pre-mutation, not normal, not mutated. So this person, if this is a girl, and if this girl passes on this abnormal gene to her next generation, then in the next generation, the number of CGG repeats may expand. This is a possibility. So her next generation will become a full-blown Fragile X syndrome person rather than a pre-mutation carrier.
Okay.
So this is something that she may not aware herself without testing. Then if she gives birth to a boy, then she has two pieces of X chromosome. If she passes on the normal X, then that's fine. If she passes on the abnormal X chromosome to a boy, then the boy may have a full-blown Fragile X syndrome. So it's a 50% chance.
Okay.
It also happens with the girl if she gives birth to a girl. But of course, if it's a girl, the symptom will be milder.
Okay. And what are the symptoms of Fragile X syndrome?
It can be quite severe. The boy will have a profound learning deficiency with a very low IQ, and also he will have abnormal developmental milestones, and also may have behavioral problems like the autism spectrum, and also some physical abnormalities as well, long face, very tall stature, and problems with his testicles as well. So for girls, they have milder symptoms.
Okay. So who should consider the testing for Fragile X screening?
Now, that means that the woman will be having a pre-mutation Fragile X gene. For these women, they will have very little symptoms, especially when they're young. So women with pre-mutation FMR1 gene, they will have premature menopause. That means they will stop menstruating, making eggs before the age of 40. But that happens in only 20% of these women. So sometimes they don't even know that they're carrying this gene. So if they have given birth to a child with this problem, then we'll ask the woman whether she wishes to be tested. And also if they have a family history of an unexplained child, why this child has suddenly be born with symptoms or suggestive of Fragile X syndrome, then we will ask whether she wants to be tested. Or even if there is no family history and she is asymptomatic, if she's worried about this giving birth to a child with this problem, and if she's planning a pregnancy, then yes, she can also be tested because it's just by means of a blood test.
Yeah. Finally, Dr. Chan, I mean, what are some of the common diseases that we see here in Hong Kong? I seem to remember, and this goes back a few years ago, I seem to remember thalassemia and brochures for it, and it's quite prevalent in the Hong Kong population.
You're right.
Yeah.
Thalassemia is very common in the Chinese population. There are two types of thalassemia, the alpha thalassemia and beta thalassemia. Alpha thalassemia, the prevalence is around 5%, whereas for beta is 3%, which is not low, isn't it? So you can have, these are the autosomal recessive diseases, meaning that if a woman is carrying for example, a beta thalassemia gene, but if her partner is entirely normal, carrying two normal genes, then their children will perfectly healthy, at most a carrier who is also healthy. But if this woman is carrying a beta thalassemia genes, and if her partner is also carrying an abnormal beta thalassemia gene, then they will have 1 in 4 chance of giving birth to a child with severe thalassemia. And to the extent that the child will need lifelong blood transfusion or bone marrow transplant.
That's right. So this is one disease that people can screen and early detection. And what happens when you find out that you're positive for screening? What are some of the next steps here in Hong Kong?
If the woman is already pregnant, then if we find out that both partners are carrying the same abnormal gene, then the way is, the first thing is to test whether the baby is affected, because the chance of the baby having the disease will be 25%, but 75% of the time the baby is unaffected. But we have to know. So the way to tell is, again, by means of amniocentesis. We draw some amniotic fluid out for testing to confirm whether the baby is affected or not. If the baby is confirmed to be affected, then it depends on the disease that we are talking about, for the severity of this disease, whether and the parents' wish as well. Now, take the example of alpha thalassemia. If the baby is affected by alpha thalassemia major, it will not just affect the baby itself, it will also affect the mother. The mother will have a lot of amniotic fluid during pregnancy, we call polyhydramnios, and that will put her at risk of having bleeding after, heavy bleeding after delivery. And also the condition, the fact that the baby is affected by severe alpha thalassemia, that will put the mother at risk of having preeclampsia, high blood pressure during pregnancy. That's very dangerous for the mother. So if the baby is really affected by alpha thalassemia, then we will really discuss with the mother whether she should terminate the pregnancy for herself and also for the pregnancy itself.
Okay, well, there are many options available, and definitely, would you recommend people getting prenatal screening then?
Yes, in a way, yes or no. Now, in Hong Kong, we do not have a very clear guideline from the local authority. But take the example of America. The American College of Obstetricians and Gynecologists, they actually recommend doctors talking to women who are contemplating pregnancy and see whether they want to be tested for some commoner or more severe genetic diseases. The list of genetic diseases are very short. It's like the first one they recommend for testing is SMA, spinal muscular dystrophy. Right. The second one is cystic fibrosis. The third one is actually hemoglobin problem, like thalassemia. And the fourth one is Fragile X syndrome.
Oh, okay. So
and the fifth one is now depends on the ethnicity, because we know that some genetic diseases tend to run in certain ethnic population. Yeah, so actually those you have asked that is actually recommended to be tested by the American Society.
Oh, okay. Awesome.
But of course, it's a personal choice. Whether the women would like to take it on board is up to their decision.
Yeah. Well, finally, Dr. Chan, it's so nice to talk to you and to meet you in person. Can you remind our listeners, have you got a website? How can we find out more about you and your work?
Oh, yes. Our clinic has a website, and actually, I do not want to promote the website. It's the material that we have prepared for our patients. We have written the details about genetic screening and also Down syndrome screening. If they're interested, they can take their time and read more information about these problems.
Excellent.
The website is hk-gmc.com.
Excellent. Thank you so much for your time, and that's Dr. Carina Chan joining us.
Thank you, Noreen.
Thank you.